Hello all and welcome back to PHYSIO TV Classroom. Today we are going to see a range of motion evaluation for the spine, that is cervical spine. Till now we have seen for the upper extremity, lower extremity in two various parts. Okay, for the shoulder different, for the elbow different, hip, knee different, ankles, for every joint we have seen it. Now we are going to see how we can check the range of motion at the cervical spine. Okay, as now we have seen we have to check for the range of motion at the cervical spine. So to check the range of motion, we have a universal goniometer, okay, which looks like this, in which we have a goniometer and a fulcrum, a movable arm and a stationary arm. All right, and the second method for which we have a tape. So we are going to see both the methods for checking the range of motion at cervical spine. Good. Okay. Now firstly we will see what are the cervical motions present at the cervical spine. Okay, so mainly we have a cervical flexion. So here we can see your chin is touching to the sternum is cervical flexion. All right, then your chin going away from the sternum, okay, is we call it as cervical extension. So movement is happening at your cervical spine. All right, then you are looking towards one side, keeping your trunk straight. Okay, so your chin going towards one shoulder, okay, is your rotation towards the right, and away towards another shoulder is rotation towards your left side. Similarly, we'll see how we can see what is the normal motion of cervical lateral flexion. Okay, cervical lateral flexion means laterally towards one side. Okay, so your neck or your ear touching to the shoulder, okay, is cervical lateral flexion because it is his left side, so left side cervical lateral flexion. And if the neck is laterally flexed towards another side, so your ear touching to the right side shoulder is cervical lateral flexion of the right side. Now we have seen how the normal range of motion is present in the cervical spine. Now we are going to see how we can assess the range of motion of cervical flexion. Okay, for the flexion, as we have seen, this is the normal cervical flexion movement. Okay, now we are going to objectively measure it. So for that we will need a universal goniometer, okay, and some landmarks. So first landmark which we need, where we are going to put the fulcrum, is the external auditory meatus, okay, and the base of nares for the placement of movable arm. Now I will explain how you can place the goniometer to check the cervical flexion range of motion as well as extension range of motion. So firstly, your fulcrum should be at external auditory meatus, then stabilizing arm will be perpendicular, and your movable arm will be placed or parallel to the base of nares. Okay, this is how you can place the goniometer for checking the range of motion. This is the initial position for checking the range of motion. So here you will check what is the initial range. Here it is coming to the 90 degrees. Then I will ask the subject to take neck in flexion, that is take neck down, take your neck down, try to touch your chin to the chest. Okay, relax. Now here you can see it is reached towards 50 degrees, come back to normal. Okay, now as we have gone from 90 degrees to 50 degrees, the difference between is 40 degrees, which is ideal for the normal adult individual. Okay, now similarly you can check for the cervical extension in a similar manner. You just have to keep the goniometer again in the same position and then ask for cervical extension. Take your neck back. Yes. relax, take it to the normal. Okay, so here we got the after range is 120 degrees, so 90 to 120 degree is around difference of 30 degrees, so around 30 to 40 degrees of cervical extension is present in this person. The next method to check the cervical flexion and extension range of motion is with the tape method. Okay, so for the tape method you need two reference points, for which we have a chin, okay, the tip of chin and the sternal angle. Okay, so from the sternal angle to the tip of chin is the initial readings you have to note. Then as for the cervical flexion, take your neck down. All right, take it back. Okay, so initially it was at 13 and now it has come to 8, so the difference is of 5 centimeter. So around 4 to 5 centimeter is normal for cervical flexion. Similarly, you can do it for extension. Take your neck back. Alright, so here we have got till 19. 19 minus 13 is roughly comes about 6 to 7 centimeters of difference. Okay, you can relax. So extension range is more than your flexion range. So now we have seen cervical flexion and extension, how to check. Now we are going to see cervical rotation towards one side. Okay, so this is how we check for the cervical rotation. Firstly, what we have to do is with your goniometer. Okay, so your fulcrum will be at the vertex. This is the vertex of your head, so it will be like this. Okay, then your movable arm will be parallel to the imaginary line from one acromion process to the another acromion process. Okay, and the movable arm will be parallel to your nose. Okay, now this is how you can place a goniometer. So initial range is 90 degrees over here. Now I will ask him to rotate towards one side, that is on the right side. Take your neck to the right side. Alright, so the last range is 140 degrees. Okay, come back to the normal. So 140 to difference of 90 is roughly comes around 50 degrees. So you can check it on the opposite side also. So for the normal individuals, adult individuals, it is okay to have a range between 50 to 60 degrees of cervical rotations. So the next method to check cervical rotations, firstly we have seen with the universal gonio, now we will see with the tape method. Okay, for the tape method, again the reference point is tip of the chin, okay, from to the acromion process. Okay, so this is his initial range. Then I will ask to rotate to the one side. Take your neck to the one side. Okay, that's it. Now here we are getting around 10 centimeters of difference. Okay, so around 10 to 13 centimeters of difference is acceptable or is normal for tape measurement for cervical rotations. I have shown it for the right side, so we can do it on the both the sides for the cervical rotations. So till now we have seen cervical flexion and cervical lateral flexion. Okay, oh sorry, cut. So till now we have seen cervical flexion, extension and cervical rotations. Now we are going to see cervical lateral flexion. Okay, for that firstly we will need subject to be in sitting position. For all these positions we have taken subject in the sitting positions. Now we know this is the cervical lateral flexion movement. Okay, so for that the placement of universal goniometer is such that, so chin should be in chin tuck position. Then you have to palpate the C7 vertebra. The spinous process of C7 will coincide with the fulcrum of your universal goniometer. Okay, then your stabilizing arm, okay, will be parallel to the dorsal aspect of your spine, and your movable arm will be parallel to the dorsal aspect of your head or back of the head, or you can say protuberance. Okay, so from here we are going to check the range of motion. So here it is at the 0 degrees. Now you take your neck to the right side. Alright, so come to the normal position, initial position. Alright, so this is how you can check the cervical lateral flexion on the one side, and you can do it on the opposite side. Alright, so next we are going to see how you can check this with the tape method. Okay, now we are going to see the next method, that is the tape method for checking the cervical lateral flexion. Okay, in the universal goniometer we have checked with the goniometer, and the ideal range of universal goniometer should be around 20 to 25 degrees. Okay, and now for the tape method, so again you need 2 reference point. So here at the back of your ear we have a mastoid process. Okay, from your mastoid process to the acromion we have to check the measurement. So the initial measurement is this. Now I'll ask subject to flex the neck towards the right side. Now I'll ask the subject to flex the neck towards the right side. Alright, is this, or you can go a little bit more? Okay, fine. So here we are getting around 8 to 10 centimeters of difference. So you can check this on the both the sides and compare for the any tightness in the neck flexors, lateral flexors. Thank you. Now in this session we have seen how to check the range of motion at cervical spine. Okay, so we have seen different methods to check the range of motion for the cervical spine. In the next session we are going to see how we can do it for the lumbar spine. Alright, and stay tuned for it. So at the end of this session, now I would like to thank our principal who has given the chance to do a session on Physio TV. Also, I would like to give thanks to Parag Sancheti sir, our chairman, and Mrs. Manisha Sangvi ma'am, our executive director, and to the audience for joining this session. Thank you so much.